something?
Yeah. So you have oropharyngeal airways and nasopharyngeal airways, or NPAs and OPAs. So they're just airway devices. This one goes in the mouth, and this one goes in the nose. So this is oropharyngeal airway, OPA, nasopharyngeal airway,
Gotcha.
NPA.
Makes sense.
And then typically there's a lubricant packet that is with the NPAs
For that schnaz.
to be able to insert it into the nose.
Okay.
And then I did notice a set of trauma shears down here too.
Gotcha.
All these bags set up exactly the same.
Yes. So if you go from one station to the other, at least this is the same. So then here in 3, you have the Epi kit.
Okay.
So that Epi kit. You'll have your syringe, needles, prep pads, epinephrine, gauze pad. Usually there's Band-Aids in there.
Adult dose. Intramuscular. What is it?
0.3 to 0.5. So this is what's called a Broslow tape, or pediatric tape. So how it works is you can measure like the length of a kid and then flip it over, and it gives them their estimated weight based on how big they are. So you can decide your dosage based on that. It's just kind of a cheat sheet because we suck at guessing little kids.
And most of the time, we're only dealing with really one medication that's vital to get right, and that's epinephrine. So you're either gonna have a kid or an adult. So it's
I've never used one.
No, neither.
probably more useful for like a pediatric nurse or medic.
Other medications for like a medic and stuff where it's more weight dependent. Yep. Just the days of EpiPens. Not cheap. So then, the more commonly used ones is your Narcan and your oral glucose. So if somebody is in need of sugar, you can administer some if they're not able to chew. And then aspirin.
Okay.
Is
So let's say that you are just going to a common call like an overdose, which seems, the more I hear about it, that seems more common thing.
yes.
Is there a preference on like which ones you use first? Like would you just
Nope.
grab that?
Just grab one. Just grab one. Doesn't matter about date. If you were, I don't know, if you're really worried about it, I would just leave it out.
I mean, if you do your
We go through it fast enough where the date's not a factor. But if one was March of 25 and one was December of 23, you could just leave it out like that, so that'd be the first one you grab. But
Oh, I see.
if you're really worried about it, but it really doesn't matter, because we're not gonna base our date of drugs over, somebody's health, right?
Right.
Right, and if it's within, should have been taken out of the bag that morning if it was out of date.
Correct.
So either one's good.
So here, we have compartment 4.
Trauma.
So more nasal cannulas, another non-rebreather. And then our large BP cup should be in here.
Oh, I see. So large blood pressure cup.
Just one pictures on it. So there's large.
Regular adult. That's probably pretty crucial to know which is which there.
So you have adult, large adult.
Okay. Adult is just like regular.
That'd be your regular.
And some adults have very tiny arms, so if you look at their arm and you're like, oh, it's like a 5-year-old arm. Grab the peaks.
Like a elderly patient has very small frail arms.
So other specific names for that sort of tape? Is it like medical tape? And then we have
Cling.
That's what
Cling.
now?
So we just call it cling
Clean.
or
Okay.
Curlex, but usually you'll hear people call it cling.
Clean.
This is 2-inch tape, 1-inch tape.
1 inch, 1 inch.
So there, you're gonna see on the package it says sponges. We just call them 2x2s, 4x4s, whatever. We'll call them by the size. So here,
Oh, it's
hand me a
4x4.
4x4. That's what they mean. Spare set of gloves in there. And here's your gauze. Sterile water for flushing whatever.
Okay.
Use it for cleaning out wounds or like burn patients, you know, they get gravel or something in their wounds, you can clean it out. Here's the eye wash, tourniquet, another pair of shears, and then there's the
What are those?
no, the nasal cannulas and then the readers.
Cannula. Not
Cannula.
Gotcha.
Yeah, cannula.
Gotcha. Okay.
Any questions on that?
I think so.